Hi everyone, my name is Rocio Gomez. I'm also presenting on all the competencies of the Quality and Safety Education for Nurses, QSEN for short. Well, in 2003, the Institute of Medicine report, Health Professions Education, A Bridge to Quality, noted deficits in current education of all health professionals, including the following 6 core areas that needed vast improvement: patient-centered care, teamwork and collaboration, evidence-based practice, quality improvement, safety, and informatics. Sound familiar? Yes, these are also the 6 key areas for QSEN competencies. The QSEN project began in 2005, funded by the Robert Wood Johnson Foundation. QSEN has the objective to prepare future nurses with the knowledge, skills, and attitudes necessary to continuously improve the healthcare environments in which they work. I will briefly discuss each of the competencies and how they apply to nursing practice. Let's get started. The first one, patient-centered care. Nurses have a unique role in supporting patients and families to become partners in their care. I like how the Institute of Medicine defines patient-centered care: providing care that is respectful of and responsive to individual patient preferences, needs, and values, and ensuring that patient values guide all clinical decisions. This means that in patient-centered care, in patient-centered care, nurses provide the knowledge, resources, and support that each client needs to, 1, be involved in informed decision processes, 2, assume important aspects of self-care, and 3, change behaviors to promote health and better quality of life. Patient and family-centered care means that nurses consider the holistic needs of the family and the patient, and the family works as a partner with the health and nursing care team. Let's explore more about this healthcare team, how this healthcare team communicates and works together. The next competency is communication and teamwork. In order to promote patient-centered care and safety, we need to work in teams. However, conflict among the healthcare team has been present since the beginning of healthcare delivery. To meet the increasingly complex needs of today's clients, patterns of conflict and competition must come to an end, and members of the healthcare team must establish effective professional partnerships. Healthy working relationships among healthcare providers require meaningful conversations, which result when people use the following communication principles. There are 5: intention, listening, advocacy, inquiry, and silence. Intention refers to the creation of a safe place to foster collaborative learning, to share, to listen, and to connect at a deeply human level. Listening refers to truly hearing oneself and others, using not only physical, but also mental and spiritual connections to learn. Advocacy refers to the willingness to share our thinking, along with the reasons behind our thinking, with the only purpose to share, to disclose those thoughts, not to defend them. Inquiry is the willingness to ask others questions, to discover new insights, and learn by connecting diverse ideas and feelings. And lastly, silence, a time of quiet reflection to learn the lessons that were taught without words. As we use these principles of communication, we'll be able to end conflicts and establish strong interprofessional relationships, which is imperative because quality and safety for patients rely on the effective communication among all health team members. In all healthcare settings, an ideal situation would place patients first. Team members would have equal contribution to care delivery, and the goal of care would be to provide the highest quality care possible. This care will be enhanced as we, as nurses, find the best approaches to care according to research findings and evidence-based practice, which is our next competency. Evidence-based practice. I love the phrase, science seeks the truth and humans create science through research. The research process consists of a series of rigorous, logical steps of inquiry. As new graduate nurses, we must be familiar with the research process to critique nursing research studies effectively. It takes time, though, and practice to develop complete understanding and comfort with the research. So we need to take the time to regularly read relevant professional journals. However, it can be difficult to find websites that have reliable information. Anyone can add anything to the internet, right? So it is important to proceed with caution, especially researching a nursing or health-related topic. Resources that can help us answer clinical questions include the Agency for Healthcare Research and Quality, which is published by the U.S. Department of Health and Human Services. Some other ones include the Centers for Disease Control and Prevention, also the National Institutes of Health, and Nursing World, which is published by the American Nursing Association. And there are more credible resources we can access for reliable information. And we need this information so we can improve our services and patient care, which is at the center of our next competency, quality improvement. Houston defines quality improvement as the use of data to monitor the outcomes and use of improvement methods to design and test changes to continuously improve the quality and safety of healthcare systems. This means that in order to improve patient care, we need a systematic process of defining problems in order to identify potential causes and then develop strategies to improve care. This process requires the ability to measure care, because we can only improve care if we can measure how well we're doing and compare it to ourselves in the past or to other organizations. Nurses are frequently seeing things that need to be addressed to keep patients safe and improve outcomes. And the example I have is, of course, from Florence Nightingale. I'll make it very simple, but during the Crimean War, Florence Nightingale noticed a measure of care that needed to be improved, right? And it was soldier mortality. Then she identified the problem, infections. And she identified the root of the problem, sanitary conditions. Okay, once she did this, she then developed and implemented action plans to improve these conditions by making hand washing, bathing, and other principles of asepsis and infection control mandatory. She evaluated and found that the hospital mortality rate was reduced by 2/3, which is pretty impressive. So, nursing quality initiatives do change our environments in healthcare. They can improve them. And so the pattern that was demonstrated by Florence Nightingale is still relevant today. The quality improvement process facilitates change as nurses monitor measures of care, identify problems, find the cause of the problem, and develop and implement strategies for change, and then evaluate the outcomes. A criteria for a measure of care is that it can be quantifiable and a variation of the normal. Once this variation is detected and we gather the data, we can use tools like graphs and diagrams to present this data or to see it more clearly. And as we study it, we can find patterns that can help us get to the root of or cause of the problem. Once we see it, we can develop strategies and implement and then implement little changes here and there, and then evaluate how we're doing. We can decide what we're gonna do next. Implementing changes and improve patient safety is always worth the work and the effort. And our next competency is precisely patient safety. Safety minimizes risk of harm to patients and providers through both system effectiveness and individual performance. Human factors research has demonstrated that performance, efficiency, quality, and safety are the result of the interaction between people and the system in which they work. This implies that patient safety or quality are a result of the properties of a system. That is, patient safety problems, including human errors and violations of safety protocols, are rarely the fault of the healthcare provider, but rather they emerge from the providers working with technologies which may or may not be well designed in a particular environment, which may be rushed or too dark or filled with interruptions. This is very common with nurses. Doing particular tasks that may require intense concentration in a particular organization whose culture may reward shortcuts. Many healthcare organizations have adopted a just culture for managing errors when they occur. Such a culture emphasizes what we just talked about, that work processes rather than people are usually the cause of mistakes in healthcare delivery. A patient care system is obligated to collect productive investigative data that can be analyzed and acted upon to improve patient safety. This process is not possible unless members of the organization remain vigilant and mindful, and also that they feel that they have to report, right? That they feel obligated to report those errors. However, medical institutions cannot afford a blame-free culture. Some errors do warrant disciplinary action, and finding a balance between the extremes of punishment and blamelessness is the goal of developing a just culture. And our last competency, informatics. I can find it. We can, in this day and age, we have so much information available at our fingertips. Informatics, which is the science of information, has emerged to organize this information for a specific purpose. It does it by devising effective methods for organizing, managing, and retrieving information. Computer use in healthcare delivery became prevalent in the early 21st century. In 2004, President Bush issued a mandate that required all American health organizations providing direct client care to use electronic healthcare records by 2014. To meet this challenge, professional nurse leaders, educators, and informatics experts recognized the need to develop a vision for integrating informatics into practice, education, and research. And today, nurses document pretty much all patient care into the electronic healthcare records. Although sometimes technology can impede a person's ability to engage in deep, meaningful, face-to-face conversations, having instantaneous information related to medical emergencies and community health hazards enables nurses, especially those working in the ER and community health settings, to act fast and save life. This is the most important part of our works, to save lives, and technology has provided a ton of advancements for it. Well, we have talked about, in conclusion, we discussed about all of the competencies that QCEN has put out there to prepare nurses to continuously improve the healthcare environments in which they work, right? It does this by utilizing these competencies: patient-centered care, evidence-based practice, teamwork and collaboration, quality improvement, safety, and informatics. As we continuously apply these competencies in our daily nursing practice, we will be more prepared to contribute to a culture of safety within our places of work. And as we do so, we will be providing our patients the very best quality care we can give them. Thank you.